I am fully aware that when you go see a chiropractor for the first time, it can be a very daunting thing. And so in this video, I'm going to show you or tell you what you can expect from when you go see a chiropractor to hopefully help you ease this process. And if you are on the edge of wondering whether you should go see a chiropractor or not, hopefully this video will help persuade you. Let's begin. Hello, my name is Dr. Stephen Hume. I'm a chiropractor based in Reading, and in this video, I'm going to show you exactly what you can expect from when you go see a chiropractor. Now, the first thing I do want to say is that every chiropractor is slightly different. We are trained fairly similarly depending on where we've been trained. If it's in UK, usually it's either in Bournemouth, in Wales, or sometimes it's in McTimoney College, which can be then a little bit more different than the one in Wales and Bournemouth. However, there are a lot of differences between each chiropractor because each chiropractor tends to go a slightly different direction. So although usually every chiropractor will stay focused on what we're treating and what we're affecting, we will tend to use slightly different ways of treating and slightly different ways of diagnosing or assessing the patient. And so therefore, if you went to see 2 or 3 different chiropractors, you will see a difference. Now, sometimes that's a slight difference, but sometimes that can actually be quite a big difference depending on where you go. And so I'm going to be talking about how I would normally see a patient on that first visit. And I think usually that's fairly similar to how a lot of chiropractors will see patients. So the first thing you'll tend to do is book the appointment. Now that's usually through phone by phoning reception and booking it in, or sometimes that can be online. Then you'll come in for your appointment. You'll then sit and wait in reception, waiting for the chiropractor to come out and then collect you. The chiropractor will then bring you into the consult room, and then the first thing that they'll want to do is to get as much information from you, firstly about the main issue that you're coming to see them for, but also they want to get a full history, medical and lifestyle history, so they get as much information as possible. Now, one of the things that I come across fairly often is that some patients wonder why I'm asking certain questions because it doesn't always seem that related. However, when we're trying to diagnose a problem, we want as much information as possible so that we can then give you the best diagnosis possible. Now, most of the time, it's usually a fairly simple problem, but sometimes people do come in with a more complex issue. And so we always want to cover our bases to make sure that we are treating what we think it actually is. And so if your chiropractor is asking a lot of detail or a lot of questions that doesn't seem that related, it's usually quite a good thing because the more the better. The more information that they have, the better. So do stick with that. Now, that history will tend to consist of the location of that pain, the type of pain, the severity of that pain, then when that pain came on and how it came on and how it then progressed from when it came on to where you are currently. And then they want to know when that pain is most prevalent, when you feel that the most, and what tends to relieve it, and then the daily pattern of that pain. And then they're going to want to know traumas, slips, falls, car accidents. They're going to want to know if you've had any imaging, and this is always an important point. If you have any x-rays or MRIs, it's always very useful to the chiropractor if you can bring the actual image in with you to the consultation. Then they're going to want to know any medical conditions you've got, any medical conditions in the family, as well as any medications that you're currently on, because occasionally some medications that you're taking can be contributing to the issue that you're having. So it's always good to rule out. And then they're going to want to know some lifestyle things, how much alcohol you may drink in a given week, how much you may smoke, the activities you do, the kind of job that you do, things like that. Once they're satisfied that they've got all the detail that they need from the history, then they tend to go on to the examination. And when we come on to the examination, the chiropractor will very likely ask you to take certain bits of clothes off, and usually that will be at least the shoes and socks and any tops that you're able to take off. Essentially, the more skin that we can see, the better. Obviously, we want to maintain your dignity, but for diagnostic purposes, it's really good to be able to see the condition of the skin. It's good to be able to see the actual spine, the curvatures of your spine, as well as the condition of your individual muscles around the area that we're assessing. Sometimes they may even provide you with a gown to make that a little bit easier. Now, the third thing the chiropractor will do is to take an observation. We want to see certain things like posture and that sort of stuff. Then we'll move on to looking at range of motion to see how well you can move. Then after the range of motion, we wanted to then check the individual motion of each one of the joints within your spine. And I would typically start with the low back and work my way up all the way to the top of the neck. Now, I'd always check the entire spine with everyone, because even though you might just come in with neck pain, one area of the spine can very easily affect another area of the spine. The spine works in concert with itself, and so one area can affect another area. So we want to make sure that the entire spine is working to the very best of its ability. Once we check the motion and function of the spine, then we'll typically check the nerves that are coming out of the spine, whether that's the nerves going down your arms, down your legs, or into your head, so your cranial nerves. This gives us a very good idea of the function of your nervous system, as well as if there's any issues in the spine that are irritating any of the nerves going to a specific area of your body. Then towards the end of the examination, we'll do some provocative tests. Now, the idea of these tests is to find out which tissue exactly is causing the pain that you're experiencing. After this point, I would personally give a very brief explanation of what I think is going on, and then book you in for a second session so we can go through more specifically what the issue is, and also go through the best plan going forwards for you to then deal with the issue. And whether that's a treatment plan that I can provide you, or if I need to then pass you over to somebody else who is better equipped to be able to deal with the issue that you've got. So that's generally what an initial consultation will look like. Now, this will vary from chiropractor to chiropractor. Some chiropractors may have x-ray, so they may want to x-ray you on the first visit if it's indicated. Some chiropractors may have different things that they might want to do or add into that, but that is the basic structure usually of how chiropractors will want to assess you. And the amount of time that will take will be usually around an hour. Some less, some maybe a bit more. So I hope this has been useful. If you found this useful, you might actually find this video here useful, where I go through what we treat as chiropractors, because one of the biggest myths about chiropractic is that we only deal with the spine. However, this is not true. We actually deal with a lot more than just the spine. So in this video, I go through this. So hopefully I'll see you over there on this video. Otherwise, I'll see you on my next video. Take care and bye-bye.